Welcome to my Wellness Lifestyle channel. I'm Dr. Bo Ellis, and it is my pleasure to share the secrets to turning on your own inborn power to heal, to get well, and to stay well. Please help me share this wellness information with the world by clicking like, share, and subscribe. Thank you. Enjoy the video, and remember, it's what you do with what you know that makes the difference. May the Lord bless you and keep you. May His face shine upon you. Have a blessed day. Welcome. This is Dr. Bo Ellis, and I am going to talk to you today about some things you can do if you have acute low back pain. First thing I want to do is just spend a few seconds on going over all the tissues and stuff of the low back. As you can see in here, this is a model of just the spine. It's missing a few things. A few of the tissues here, as far as pain generators go, it could be the bone. It could be the ligaments around the bone, okay? It could be the tendons attached to the muscles. It could be the muscles themselves. It could be the cartilage in between every one of these little joints in here. It could be the cartilage, the fibrocartilage here in between each bone. These are called discs. The cartilage that's in between here, everyone in the back part of the joints, is called hyaline cartilage. It's a different type of cartilage. It's important to know some of those tissues and, of course, what they do and their longevity, how strong they are, and what their purpose is. The other things in this area, of course, are these nerves. Nerves come out of the spinal cord. They come out of the holes between the spine, as you can see in through here. And, of course, blood vessels. You want to take a look at all those things when considering pain generation. Anyway, possible causes for acute low back pain. I'm just going to run through a few, and then I'm going to focus on the most common causes and what you can do as far as a few stretches on your own to help alleviate it enough so that you can get in to a chiropractic office or somewhere so you can get treated and taken care of. Some of the causes, starting at the beginning, vascular insufficiency would be one of those things. If you don't have enough blood supply, enough nutrients, enough oxygen, and stuff getting to a tissue, it's going to die off. It's going to strangle out, possibly, choke out, and you're going to have pain from a lot of waste product buildup because you're not cleaning the area out, you're not flushing it quick enough. It's just getting more toxic, and of course, pain-producing chemicals build up, and you feel pain. It could result in acute pain. It would start with chronic, and it could end up in acute pain. Infarction, infection, inflammation. If you have a stroke in the area, same thing, that kind of thing is going to happen. You're going to get some swelling, just like if you sprained your ankle, it's going to swell in the area. It could be very acute. Hold on, I've got a few notes right behind the camera just to make sure I stay on track. Anyway, the other possibilities would be a neoplastic tumor. Not likely, but it's a possibility if a tumor breaks or something happens suddenly and could result in acute low back pain. Tumors and things will have a tendency to press on blood vessels, nerves, even the bone and stuff. There are no pain fibers in bone, however, but there are pain fibers all along the soft tissues within bone and surrounding bone. Degenerative joint or degenerative disc disease. These discs in here, yes, they can wear out. They will never wear out if taken care of properly. They'll virtually last forever. Research shows that as long as these things are lubricated well, as long as it's healthy, it's taken care of, they're strong. The friction, the coefficient of friction is 1:1, which is like taking two ice cubes together, two flat surfaces and rubbing them together. There's just virtually no friction, and they'll basically last forever. However, we know that that doesn't happen because of certain things that take place in our bodies. We don't take care of ourselves well enough. We get traumatized and so forth, which is, of course, another potential possibility for cause of acute low back pain. There can be congenital anomalies like spina bifida occulta. Sometimes you're born with an incomplete bone back here. Basically, if you don't have a spine, and that's the spine's process right here, not the spine, the whole thing in general. But if you're missing this here and you've got a big hole and your spinal cord is just open, it doesn't necessarily mean that it's going to cause any pain. Most of the time it doesn't cause any pain, but it can be something that complicates or allows for acute low back pain. Is something to consider. One of the other things, as far as congenital anomalies go, sometimes some people in here, they have a spatulated transverse process. And what that means is that this thing here, this is a transverse process, this is a transverse process, all these are transverse processes, all the way up the spine here. They stick out to the side, that's where muscles can attach so that you can do your job. Spatulated transverse process is one that comes off the bone here, and it's kind of like a moose's rack, where it fans out like a spatula and it attaches here to the sacrum. It becomes a very immovable joint for the most part, very small movements, and it messes up your biomechanics and can create an environment for acute pain. Okay, it's not a cause for acute pain, but it can set up for a reason to have acute pain. It's something, again, to kind of look at when you have acute pain. Autoimmune disorders. Some disorders, your body will attack itself, whether it has to do with all the tissues I mentioned, the bones, the ligaments, the soft tissues, the tendons, the ligaments, the muscles. Anything that's in the body in here, it can be attacked if your body is confused. If there's not a good connection between this part of your body and your brain, you could possibly develop an autoimmune type of disorder, although I think there's a lot more to it than that. I don't want to spend a lot of time on that. So let's move on to trauma. Trauma and degenerative disc disease or joint disease is probably the most common for acute low back pain. Usually you have something chronic for a long time, and then all of a sudden there's an acute episode of a chronic condition. That's the most common. And trauma, it could be a car accident. It could be a football injury. It could be lifting weights and doing heavy squats. It could be all kinds of stuff. It could be injury to the bones. It could be injury to the muscles, the ligaments. It could be injury to, the disc on the front, or the disc that you can see from the front, resulting in a herniation either on the side or in the back. The back, the posterior portion, is the most common injury to a disc. The most common area that is ruptures or you have torn fibers. The last thing I'll mention just kind of really quickly is an endocrine disorder. You could have a problem in your prostate, your kidneys, your ureters, your bladder, even your colon. And all of those, of course, have to do with the nerves that come out of this area. They go to those areas, and also pain is referred. From the kidneys, T11, T12, L1, those are the nerves that go to the kidney mostly. But the kidney will refer down to the low back. So if you have unrelenting low back pain and it doesn't correct with any type of stretching, manual therapies, electrotherapies, things like that, then you really want to consider your kidney, because or your prostate, or like I said, the bladder, the ureters. If maybe you have kidney stones, things like that, that'll cause some acute low back pain as well. So some things that you can do, hopefully, to alleviate at least degenerative and traumatic, and sometimes this isn't even included in the diagnostic criteria, but what happens a lot of times is that these joints in here, they get stuck, and that's what chiropractors call subluxation. It's less than a complete dislocation. It's just an abnormal positioning, poor posture of that particular part of the spine. It's just not working. So what happens is the muscles, the ligaments, the tissues in the area, the discs, the bones, they atrophy, they get weak. And over time, that weakness, as it continues to get weaker and weaker, you bend down to tie your shoe, which is very, very common for a lot of people. You get up out of bed in the morning and all of a sudden you have acute low back pain. It's not because what you did is something new. It's something you've done 100 times, you do every day. You're getting up, you're going to the bathroom, putting your clothes on, like I said, or tying your shoes. Those are the most common, causes. And they're not causes, they're just things that you're doing, and all of a sudden it's the straw that broke the camel's back, right? It just got so weak that all of a sudden it went into spasm, and that's what caused the acute low back pain. So usually it's a weak area that's going into spasm, it's splinting, it's protecting itself from you injuring it any further. It's a very good protective mechanism, but it is also very painful. So let me show you a few things that you can do really quickly when you're in acute low back pain. And when I say acute, I mean that's the kind of pain that you don't want. It's the stuff that will incapacitate you, hospitalize you, make you feel like you're going to, break in half or die. Okay, acute low back pain. So one of the stretches you can do, And of course, if you're on the floor, more than likely you'll probably be on the floor by this point. I'm going to use a bench so you can kind of see what I'm doing. And I'm just going to run through a few things really quick because there's not a whole lot you can do when you're in acute pain. You don't want to move very much. You don't want anyone touching you. You don't want to move because every time you move, it hurts a lot. All right. So one of the things that you can do if you're on the floor, you can move really slowly. Okay, knees to the chest. You're gonna have to use your arms to kind of pull your legs so you don't use the muscles of your lower back. And then you just pull them down nice and slow. Pull them as far as you can get them. And you want to just squeeze and hold them there. You can wrap your arms around your knees, and then you want to use your breathing. Breathe in really deep through your nose. Nice, slow, controlled breathing. And you want to move your ribs. You want your chest to rise and to fall. And that actually is going to activate your sacrum, your low back, and it's going to get just a tiny bit of movement in there, which is safer for your body. You know, it won't splint it more. You should be all right. And just hold that stretch for about 5 minutes or so. It's going to be a nice long stretch. All right. Another thing that you can do stretch-wise is if you're in a seated position or in the laying position, I'll show you both of them. But just take your hands and you stick them on your hips, either like this. You can stick them in here like that, and hopefully your wrists don't hurt. You can stick them any way you want. It doesn't really matter, but the thing is you want to get the heel of your hand in as far as you can on your legs, right into your hips, in through here, and then you want to straighten your arms out, and you're going to relax your back as much as you can, and breathe in nice and deep, and slow out. Now just separate your low back just a tiny bit. That's all you're trying to do, is just a little tiny bit. You don't want to do a super amount. You don't want to kill yourself. You don't want to tear any more fibers. You don't want to go into more spasm. You're just looking for just a little bit of relief. And you want to do that, and you want to hold, and you want to do a little bit of stretch, push down, and then relax. So stretch and breathe. When you're done a breath, try to let go a little bit. I'm going to exaggerate this a little bit. You don't have to do quite that much, but stretch, breathe in and out, and then relax again. Okay, in the laying down position, it's the same thing. Have your knees bent, hips bent, and again, you're going to push straight down into your legs. You're pushing straight down into your legs. And you should feel your back separate just a little bit. Okay, so you want to have your back nice and flat. You don't want to arch it a whole lot or anything, but you want to breathe in and out. And just take your time with it. Take your time, small movements. Because when you're in acute pain, you really don't want to move a whole lot. All right, let's see. A couple other things that you can do is, if you are standing, if you're not on the floor, you can find a countertop that's nearby, a chair, something like that. And you can put your hands on that instead, and then just let your lower body stay on the floor and just lift your body up a little bit. It's going to be a little bit difficult to do it on here, but basically get your hands on here on the countertop. The countertop's going to be higher, about waist level, and then you're basically just letting your lower body fall down, and you're holding your upper body up. Okay? And you're going to breathe again, in and out. One more minute here. We got a patient coming in, so let's see. There is another thing that you can do, and that's putting your hands on a bar, like a monkey bar, something like that, and you can hang and just drop your lower body. Again, the same thing with a counter. You're just trying to separate your low back a little bit. So you just grab a bar, and you're going to bend your knees a little bit. Can't really show you too much here. I'm sitting down, I only have so much room, but you're just going to bend your knees a little bit. So if you're holding onto a bar up here, you're just going to bend your knees a little bit while you're holding onto that bar. And just a little bit of pressure, a little bit of pull in your low back. Again, try to breathe in, try to breathe out, nice and slow, nice and smooth, and relax. And do that, for, obviously you're going to get tired holding onto a bar, but you want to do it for 5 minutes, maybe 10 minutes, maybe half an hour. You definitely want to rest and relax, let those muscles recuperate. Okay, there's nutritional things you can do as well. I'll put a couple of things down on the link that you can purchase to get the muscles and stuff to relax, because you want the muscles to relax. You want to make sure that you have enough calcium, magnesium, and so forth, so that your muscles don't just cramp. Because sometimes muscles not only go into spasm, but they can cramp also, and a cramp can cause the muscle spasm, and then of course you can cause injury to your body, your muscles, your bones, your tendons, your ligaments, just from a real serious muscle spasm. All right, it was a pleasure. Thank you very much. Hope you learned something. I hope some of this helps. Have a good day.